Hello, sir. Good day. We are the last group 2%, and the topic that we are about to undertake is about the antibiotic usage in the community, where we focus in the residents of Bacolod City, Barangay Estefania. For the next slide, what we have here is the presentation overview, where you can see the contents of each slide that we are going to report. For the introduction, modern healthcare relies heavily on antibiotics. Their imprudent use leads to the rise of antibiotic resistant bacteria, which poses a serious global health threat. The Philippines' absence in global antibiotic resistant evaluations highlights a critical gap in understanding antibiotic misuse on certain residents, and the lack of effective antivirals led to widespread and excessive antibiotic use that causes anxiety and uncertainty. So, in other words, the knowledge about antibiotic treatment is an important key to be aware of the antibiotic resistant bacteria that are thought to influence the patient and parent demand for antibiotic prescribing that we should follow, so that we will remain educated and know how to use the medication that is prescribed by the health professionals. Now, in summary, this study aims to uncover the antibiotic usage patterns and perceptions among the residents of Barangay Estefania, contributing to the global fight against AMR, or also known as the antimicrobial resistance, that analyzes these trends in a rural community that can facilitate the development of tailored initiatives and educational campaigns promoting responsible antibiotic practices and mitigating the impact of antimicrobial resistance or in the public health.
Next slide is the problem. In the month of October, the study aimed to assess the understanding of behaviors of residents in Barangay Sifania, Bacolod City regarding to the use of antibiotics. The following questions will be addressed by the researcher. So first, how much of the residents of Barangay Sifania know about the side effect or misuse or excessive antibiotic use? Second is how much knowledge of residents in Barangay Sifania have antibiotics, including knowing what they are, how they work, and how to get them. Lastly, how much of the residents in Barangay Sifania follow the recommended practices of using antibiotics and how they likely use antibiotics.
The scope of the problem. The purpose of the study is to determine the repercussions of antibiotic use in the Barangay Estefania that lives in the city of Bacolod. This also tries to understand how members of a specific community perceive antibiotic usage, including rationale, frequency, and sources. Surveys, interviews, and medical records analytics will be used to collect data on antibiotic use. Furthermore, this emphasis is on knowing how antibiotics are used in the target population.
Rationale of the study. All antibiotic use, whether appropriate or not, can promote the emergence of resistance in bacteria. Unfortunately, inappropriate and excessive use of antibiotic is common in both high and low income countries, and in both human and animal sectors. To limit inappropriate use of antibiotics, it's very crucial to preserve the effectiveness for both human and veterinary medicine. For some bacterial infections, antibiotics are life saving medicines. Likewise, treatment with antibiotics is necessary for certain diseases in animals in order to ensure survival, welfare, productivity, and to reduce spread of disease. While in the realm of medical science, the fundamental goal underlying antibiotic therapy revolves around the achievement of effective and precise treatment for individual patient grappling with bacterial infections. This objective can be attained most efficiently when healthcare professionals meticulously curtail the adverse effects, carefully select the appropriate pathogens, and actively combat the emergence of resistance. Meticulously navigating the delicate balance between these factors, clinicians can optimize clinical outcomes, ensuring the ensuring not only the well-being of their patients but also contributing significantly to the larger battle against infectious diseases in the broader community. So, the study highlights that all antibiotic use can lead to bacterial resistance, with widespread inappropriate use in both human and animal healthcare. So, the key points or the key message is that limiting inappropriate antibiotic use is vital to preserve their effectiveness. Antibiotics are critical for saving lives and animal health, and in medicine, precision in the treatment is crucial. Healthcare professionals must balance side effects, pathogen selections, and resistance to optimize patient care and combat infection diseases in the community.
Statement of the problem. In a month of October, the study assessed the efficiency of understanding and behavior of residents in Barangay Estefania, Bacolod City, relating in the use of antibiotics. General objectives. The primary objective of the study is to assist the knowledge and action in the Barangay Estefania, Bacolod City regarding the use of antibiotics. Particular objective: understanding the pattern of antibiotics resistance in different bacteria and region. Next, researching and developing new antibiotics or alternative treatment to combat antibiotic resistance bacteria. Next, studying the appropriate use of antibiotics including dosage, duration, and combination to maximize their effectiveness and minimize the development of resistance. Next, studying the impact of antibiotics used to patient outcomes, including treatment success, recurrence of infection, and potential side effect. And last, assessing the effectiveness of educational campaign intervention aimed at healthcare professionals, patients, and the general public to promote awareness about antibiotics and antibiotic resistance.
Hypothesis. There is no significant differences in the degree of knowledge and practices among the people of Barangay Sefania, Bacolod City when categorized by age, gender, socioeconomic positions, and educational achievements. There is no statistically significant association between the degree of knowledge and practices among the people of Barangay Sefania, Bacolod City.
Significance of the study. The results of this study would be highly beneficial to the following: health officials for Barangay Stefania communities. The locals would benefit from these studies, accurate insights, and be able to appreciate the significance of using antibiotics responsibly. This would also clear up any misconceptions the locals may have about antibiotics, their appropriate uses, and any possible hazards involved with their use. And also Barangay Estefania health officers. The findings of this study would notify the health officers of the residents of state of knowledge, practices, and behavior towards antibiotic usage. This may also facilitate them to formulate efficient strategies in promoting community awareness concerning antibiotics use. Local government's official. The findings of this study would enable local government representatives to design and carry out education and awareness initiatives that could counter residents' antibiotic misinformation and abuse. And also for researchers. This study would give useful knowledge to the researchers and improve their understanding of the proper usage of antibiotics and the corresponding adverse effects in line with their misuse. And last, future researchers. Future researchers could benefit from using this study as a valuable reference, and it might be modified to focus on antibiotic use in a particular population.
The scope of the study. The study focuses mostly on healthcare settings, but is also considered community-based public health studies on antibiotic resistance prevention. Open to wide array of article types such as original research, reviews, guidelines, and commentaries aiming to advance innovative and evidence-based practice in infection control.
The objective is to alleviate the burden of healthcare-associated infections and antimicrobial resistance by fostering a deeper understanding of factors contributing to the emergence and dissemination of multi-drug resistant pathogens, recognizing the distinctions between environments with limited, moderate, or ample resources, thereby promoting more effective solutions for the future. Definition of terms. First is antibiotics. Conceptually, these remarkable pharmaceuticals combat bacterial infections in both human and animals, employing a dual approach to tackle the issue by either eradicating the bacteria entirely or impeding their growth and reproduction. They effectively safeguard the well-being of individuals and creatures alike. Next is misuse. Conceptually, it refers to the inappropriate or incorrect use of something, typically a tool, resource, substance, or information in a manner that deviates from its intended purpose, resulting in potentially negative consequences or unintended effects. In this study, misuse is operationally defined as one of the habits that respondents commonly engage in with antibiotics. Next is antibiotic-resistant microorganisms. Conceptually, it often referred to as superbugs are bacteria, viruses, parasites, or fungi that have developed the ability to withstand the effects of antibiotics, which are drugs designed to kill or inhibit the growth of harmful bacteria. Over time, due to overuse and misuse of antibiotics, some microorganisms have evolved mechanisms to resist the drugs meant to eradicate them. Next is antibiotic resistance. Conceptually, it represents the intricate phenomenon wherein bacteria, viruses, or fungi acquire the ability to withstand the effects of antibiotics and other germ-fighting treatments. This encompassing term encapsulates the emergence of defense mechanisms in these microorganisms, challenging the efficacy of our design interventions. After that is Neisseria gonorrhoeae. Conceptually, is a species of bacteria that causes the sexually transmitted infection (STI) known as gonorrhea. Gonorrhea is a common bacterial infection that can affect both men and women and is primarily spread through unprotected sexual contact with an infected person. The bacteria primarily target the mucous membranes of the reproductive and urinary tracts, but they can also infect the throat and rectum. After that is knowledge. Conceptually, it refers to the understanding, information, skills, and or personal exploration that allows an individual to comprehend effectively. In this study, knowledge is operational defined as the extent to which the respondents understand a particular topic. After that is practices. Conceptually, it refers to any activities that allow people to put into practice the knowledge and skills acquired through any informational materials or experiences. In this study, practices are defined as behaviors or actions individuals adopt or engage in regularly when taking antibiotics. After that is residence. Conceptually, it refers to individuals who have established their primary dwelling or inhabitation in a particular place, typically a specific geographic area or community. In this study, residence is operationally defined as the respondents of the research.
Now for the review of literature. On the first dot, what we have here is the antibiotic resistance is a global problem, and understanding public knowledge, attitudes, and behaviors regarding antibiotic usage is crucial in addressing this issue. So, in other words, when you try to understand the patterns of global antibiotic consumption, this can help us address a number of public health challenges, and also when you try to combat drug resistant infections to provide easy access for the public to basic treatment. Sorry. And for the other term, where antimicrobial resistance jeopardize the advancements in modern health care that we have come to rely on, such as joint replacements, organ transplants, and cancer therapy. So these procedures have significant risk of infections, rather, and patients won't be able to receive effective antibiotics if they are not available, and also with insufficient education on proper usage of antibiotics. Now for the second dot, what we have here is that studies conducted in different regions have shown misconceptions and improper practices related to antibiotics, which is true. So when you try to take antibiotics too often or for the wrong reasons, it can change the bacteria so much that antibiotics don't work against them. So this is called bacterial resistance or antibiotic resistance. And there are some bacteria that are now resistant to even most powerful antibiotics available. So as much as possible, we will try, or you should try to avoid the improper use of antibiotics or the excessive use of antibiotics, because there are lots of side effects when you try to abuse the use of antibiotics. Now for the last dot, what we have here is these studies emphasize the importance of education in promoting responsible antibiotic use. So like I've mentioned before, understanding the patterns of global antibiotic consumption can help us address a number of public health challenges, which combats drug-resistant infections to provide easy access to basic treatment. So, excuse me. When you try to educate someone in the public about, or in the community rather, you should provide easy education or general education for the antibiotic usage when you try to educate someone, because when you prescribe the medication to someone or in the public, they will it will influence the patient or the parent or borderline into their family tree. It will influence the treatment and awareness of antibiotic resistance to them, and also letting them know the side effects and the whereabouts of antibiotic usage, and also the side effects of improper usage and also excessive usage.
Review of literature. Factors such as education, age, gender, profession, and income influence people's knowledge and attitudes towards antibiotics. Concerning practices such as antibiotics for viral infections and obtaining antibiotics without prescriptions have been identified. Individuals with lower education and income levels, particularly in rural areas, may be more prone to improper antibiotic use.